As you can see, we're going to talk about neonatal care in the animal shelter today. So we're going to start off talking about what the issues are about having neonatal puppies and kittens in our shelter. Then we're going to do a whirlwind tour of neonatal development. And I see some pretty familiar faces. I see some rock star bottle baby kitten fosters that work at the Tompkins County ASPCA volunteer there. So you guys may even actually be better at this talk than I am. We are going to talk about neonatal care, so all of the things that you need to consider when you're caring for neonates. Important to know that we talk about neonatal care in the shelter. I am not talking about caring for them in the shelter at all, because it is most important to get those neonates out of the shelter and somewhere else. Though there are some programs that can be accomplished, which we'll talk about at the end. And then we'll finish up by talking about pathway planning and programs that you can kind of help achieve that pathway. So, survey time. How many of you guys are routinely providing care for kittens too young to be adopted? Super common. Okay. And how many of you guys are in shelters that are routinely providing care for puppies that are too young to be adopted? Not as many. So how many of you guys that are providing routine care to puppies, what region are you from? I just want to get an idea. Philadelphia? Where else? Binghamton. Are you guys doing transport? Okay, so a lot of the young puppies too young to be available for adoption are coming on transport from the south. We see it very frequently that you see bottle baby puppies and stuff in the southern shelters. In the northeast, I wouldn't say we've spayed and neutered it away, but by and large, the problem we're seeing is neonatal kittens. We all talk about kitten mountain, kitten season, all of that. Great, so what are the issues with having kittens and puppies in the shelter? And we're talking neonatal ones that aren't ready to be adopted. So they require a higher level of care, right? Especially those bottle babies that need to be fed every 1 to 2 hours. Sometimes when they get a little older, it's every 3 to 4. There are way too many of them, especially as you get farther south. I don't know why my slides are going like that, but anyway, there's too many. You've got Kitten Mountain that you have to scale every single summer. Some places it's year-round. And they actually cause us to exceed capacity in our shelter really quickly. If you don't have the ability to find foster care for these kittens, you very quickly exceed your staff's ability to care for those kittens and provide them with good husbandry. Along the lines of requiring a higher level of care, there's a higher amount of time, again, bottle baby kittens, cost. You're getting KMR, you're providing all of the other things that they need to keep them alive for that whole time and get them ready for adoption. Staff volunteer and fostering time, quite a bit of a time commitment, and they need separate housing. Also, they have a much higher morbidity and mortality, so they are more likely to get disease or exhibit signs of disease, and they're actually more likely to die from those diseases as well. So it's a huge emotional investment, it's a huge resource investment. So it's an issue trying to keep them in the shelter and keeping them healthy for the entire however many weeks it takes until they're ready for adoption. And in some states, not in New York, it is actually illegal to transfer ownership of a kitten or a puppy before 8 weeks of age. In New York, there's an exception for rescues and for shelters. We don't adopt them out before 8 weeks anyway. But if you're in one of the states that makes it illegal, it's important to know that you actually have to hold on to those animals until they're at least 8 weeks of age. So we're going to do a whirlwind tour of puppy and kitten development. And I want to point out this one. So you see Very Scientific Guide to Cat Development. As we go through the slides, you're going to see these amazing cartoons that I happened to find. They went viral on Facebook, and they're absolutely adorable. So make sure you pay attention to them. So the first stage of puppy and kitten development is your neonatal stage. They're really fragile. They're highly susceptible to physiologic stress and disease. This is the most significant period in which you experience the highest mortality in kittens and puppies. They really can't survive on their own in the slightest. They need either a mom or a person who can act like their mom to keep them alive. And their mom is truly the best, which we'll talk about again, but people can do it too. So I don't remember why I put who's the best, but we're going to skip that one. And bottle feeding is clearly for pros. I see my friend Rhoda up there, who is a bottle baby kitten extraordinaire. And for those who don't need sleep, how many of you have bottle-fed baby kittens? you don't get any sleep. They're up every 1 to 2 hours. I can tell you I've done it once, and I like to tell people it has to be the most dire of emergencies because it's almost like they're on their own when it's me trying to bottle feed a kitten. So it takes a lot of work and a lot of practice and having an excellent mentor to teach people how to bottle feed kittens and puppies. The next stage we talk about are weanlings. They're the transitional stage, eating, peeing, and pooping on their own, but they still need warmth and they need guidance. You need to kind of teach them how to be a good puppy or kitten. And then lastly, we've got our socialization period from 4 to 8 weeks. That's the window we have. It's not the only window of socialization that kittens and puppies have, but it's kind of that time frame we get before they move on to their next home. So that's a little overview of puppy and kitten development. So we're going to start going through week by week until we get to 8 weeks of age, and they're ready to be booted out of our door and into someone else's home. So we've got our 1-week-old kittens or less and puppies. They've got a suckling reflex where you touch their cheek and they'll kind of root and try and find the nipple. And they're pretty good nursers as long as they're healthy. They have a really pink, healthy skin tone. You'll notice some of these kittens sometimes they look actually a little bright pink. And you're like, oh, there must be something wrong with them. That is their coloration because of kind of their vasculature at this age. Their body condition score can vary. Ideally, the healthier kittens should be these fat little jelly beans. That's what you can absolutely compare tiny little healthy bottle babies, these little jelly beans that aren't really good for much except for eating and sleeping and crying. I'm sure some of you have been woken up by those bottle babies in the middle of the night. They clearly signal their discomfort, their hunger, their cold, they're too hot by crying. So I bet you I could play a recording and you would all be like, where's the bottle baby? I know I've been in the shelter at times and you're walking through and all of a sudden you hear that cry and you're like, oh my God, why is there a bottle baby here? Where is it? I must migrate and see whether it's this sickly little one or it's this big pudgy one, and I know exactly who it can go to foster with. They can't urinate and defecate on their own. So not only do you have to feed them, you have to potty them too. Takes a lot of time. And if you have a litter of 6 or 7 bottle baby kittens, you're basically feeding, pottying, and then starting to feed the first one in that level once you get through that entire litter. In puppies, they should be doubling their birth weight in that first week. They gain about 10% of their body weight every single day. And by day 7, if they're a healthy puppy, they should be doubled what their initial birth weight was. You'll see when we get to our next week, kittens are not within the first week, but important to know that puppies should be growing that quickly. And we estimate about 10% of these puppies and kittens coming through our doors in kind of week 1, you're identifying inherited abnormalities like cleft palate, other things like that. So week 2, we've got their eyes opening. When you're in foster, or you're working there, you're looking to make sure that there's no discharge or inflammation. How many of you guys have seen the kittens where you're like, oh, their eyes look a little bulgy and they're going to open soon, I think, and then you open it and you get a surprise. I don't want to talk about the gross surprise you get, but I think it's I feel bad for the kitten, but it's kind of gratifying for me as a veterinarian because, I like to pop abscesses and things like that. But sometimes you have to make sure that they don't have a ton of discharge and inflammation in those eyes because they've just opened. And if they have that much discharge, they can actually seal shut again, and you get even worse infections. Their ears start opening. They start to prick them just a little bit. They're not the flopped over little jelly beans anymore. And kittens should be doubling their birth weight by 14 days. So we talk about how they gain 1/4 pound a week. They gain about 1 pound a month. But in that first kind of 2-week period, they should be double whatever weight when they were born. And we have general guidelines for how much they should weigh at birth in terms of a prognostic indicator. But a further prognostic indicator is to see that they've doubled their weight. And at 2 weeks, that's when we start to deworm them. So if you have a foster, or you guys are a foster, and you got a 3-day-old bottle baby, about 11 days after you've been at the shelter already, you need to come back and get them dewormed. Because a lot of these puppies and kittens are born kind of infested with roundworms and hookworms from their mom. Moving on to week 3 to 4. So they start to develop that vision in their hearing. Their ears opened and their eyes opened last week, but this is when they really start to be able to hear what's going on around them. They start to be able to orient themselves to sound. Their vision starts to become a little more clear so they can see your beautiful face loving and squishing on them every day. This is when their teeth start to erupt. You start with their incisors right at the end of week 2 and into week 3. And by week 4, they should actually have all of their baby teeth. This is a wonderful time frame because they start eliminating on their own. So with kittens, you can start to teach them how to use the litter box. You don't have to potty them every single time you're feeding them. And puppies are starting to kind of work their way and finding little spots in their X-pens or whatever you're keeping them in to eliminate where you don't have to do it for them. They're gaining weight pretty rapidly. The kittens kind of increase a little more rapidly than puppies proportionally, but they're gaining weight pretty quickly. And they start to mimic mom. So this is where we're going to talk about how important having a mom for your kittens is. But this is really when they start to follow her around and annoy the heck out of her, and she starts to get annoyed at them, but they're really learning how to be a kitten or how to be a puppy from their mom or from whoever's caring for them. And this is when they start to transition and wean. And I'd like to direct your thought. This is the potato blorb. These are the guys that are kind of plump and fat, and they've got a cute little triangle tail for kittens, and they walk around like they own the place, but they really still can't do that much. Then we've got our weanlings. So this is really when you guys are going to have them and be able to socialize them a bunch. So 4 weeks to 6 weeks, really 4 weeks to 8 weeks, you're looking at their fear threshold is really high. It takes a lot to scare them, but actually scaring them can be really detrimental. And so this is where you're exposing them to a lot of different circumstances in the safest way possible, and they are learning that all of these different things are really important and safe and that they can be comfortable around it. They're eating gruel and soft food. They may be even eating kibble depending on what week you're in. And they're starting to get into trouble. This is where we start to talk about little kitten ninjas. We joke that the kittens are there. They look adorable, but they're this crazy ball of fluff, and they'll start to chase your feet and chase laser pointers and be these crazy little maniacs. And they have really sharp teeth. All of them are in, and they like to start using them because they're teething and they're learning to eat food and they're learning to figure out what things aren't food, like your fingers and your arms and your toes and your feet. And right around this time is when I, as a veterinarian, I want to get a vaccination into them. Because, especially if they're orphaned puppies and kittens, that we don't know anything about their mom, this is when we start to see that that might be when their maternal protection starts to wane. And so we're going to talk a little bit about kind of vaccination protocols as we go through, but it is why my vaccination protocols differ from your vet in your hometown. And I forgot to direct you guys to meow. That's when they're running around. They don't really know what they're doing, but they're going to do it as fast as they can. Then we've got 6 to 8 weeks. This is when I, as a vet, want to see them back for pediatric spay-neuter. We usually err towards 8 weeks, but in shelters where the volume of surgeries that have to be done, the number of kittens coming through, the states where there are no laws regarding transfer of ownership, I will do a healthy kitten that's 1.5 pounds and nice and fat and chubby. I'll do that 6-week-old kitten so that it can get its home and we can move on to the next kittens. You can go as low as 6 weeks, but we do typically wait until 8, 9, or 9 weeks. At this point, this is where if they're coming in around this age, we're using the 1 pound a month guesstimate for how old they are. We expect a 2-pound kitten to be about 2 months of age, 3-pound kitten to be 3 months of age. It's also our legal adoption age. Most of the laws that specify how old kittens need, or puppies and kittens need to be adopted specify either 7 or 8 weeks. Important to know that your key socialization, I talked about your socialization period that you guys were getting. This is really starting to get into the most important socialization period for puppies, in the 8 to 12 week period where you want to make absolute certain that these puppies aren't being traumatized. And you may not exactly know what could traumatize them, but you want to make their environment as safe as possible. And that's why a lot of behaviorists will recommend getting a puppy transitioned around 8 weeks or actually waiting until 12 weeks, not in the shelter environment. I don't want you to hold them all until 12 weeks because the shelter is not a home, and it's actually easier to scare the bejesus out of a puppy in a shelter. but getting them in there so that they can feel safe and they can be exposed to things in an appropriate manner so that they don't have permanent trauma and fear-based behaviors because of it. Now we're going to move on to care. And I do apologize for those of you who thought that you were going to learn a ton about puppies. A lot about puppies is very similar to kittens, but we do focus very heavily on kittens because kittens, especially in this region, are the most common kind of bear that we have to deal with in terms of neonatal care. I want to throw it out to you guys. What does the best neonatal caretaker you've ever met look like? Oh, I can't trick you guys. It looks just like a mom with her kittens, just like an adult female dog with her puppies. We are very poor substitutes for that. We can try our best, but we have to know that our best is probably still a B, and if we're not that good, it's probably closer to a C, C minus, in terms of how well we are measuring up to being a real mom. And that makes sense, right? Because we aren't cats and we aren't dogs. So, very important to know that if you have a mama cat come into the shelter, please don't separate the kittens out and be like, we can get mom adopted faster. We'll just like put her on the adoption floor now because she's sweet and we'll just bottle feed her babies. Don't ever do that. I don't think any of you would, but don't, in case you were thinking about it. So, when you've got that nursing mama coming in with her babies, you can give a modified live FVRCP to a nursing mom and kittens. We worry about vaccinating pregnant moms with a modified live vaccine because of the transmission of that modified live virus through the placenta. When they come into the shelter, it's not going through their milk. They're not getting the pan-luke portion and causing cerebellar hypoplasia. Dogs, we're giving modified live distemper parvovirus and a Bordetella combination because we want to protect her as much as we can so that the puppies aren't going to get sick as a result. And they can get their rabies vaccine as well. We want to make sure they're getting antiparasitics. So we recommend Strongid, Pyrantel, every 2 weeks to prevent transmammary transmission, so through the milk, and also to keep her as healthy as possible because since she is nursing, she's more susceptible to disease. The worms are more likely to reactivate, the ones that are encysted. And so we want to treat her so that her babies aren't then going to get more infected. We're also treating her babies once they hit 2 weeks, but we're treating her as well. Also, we want her to have her flea treatments because we don't want the puppies to get any fleas that crawl onto mom, and they're too little. So we're protecting them by protecting her. We want to make sure that mama is the queen of your castle. She should have the best food, the biggest bowl of water possible. You want to make sure that she is staying well hydrated and well nourished. She needs to have either kitten or puppy chow. She needs the highest caloric density food she can get because you don't want her to be losing weight. Although, speaking as a previous mom, or as a mom, I wanted to lose weight when I was feeding my child, but cats and dogs don't think that way, and so you want to make sure that they have the best body condition possible so that they can nourish their babies in the best way possible. And as a foster or as a staff member, if you're caring for that animal before they go to foster, you want to make sure that you're monitoring her mammary glands for any sign of infection and to make sure that she's actually lactating enough to provide for her babies. You don't necessarily need to test every teat, but you can actually look indirectly by weighing her babies and making sure that all of them are gaining daily, just like you would if you were feeding orphaned kittens as well without a mom. And you want to keep them warm and dry and happy. Like I said, it should be like a palace for this mom cat who is taking over that job that you are so grateful that you don't have to do, wake up every 1 to 2 hours and potty and feed these crying babies. This. I'm just going to change it over here. So nursing mom reassignment. You may have a mom cat come in with her 2 babies, and maybe on the same day you happen to get 2 or 3 bottle babies that don't have a mom. I am here to tell you that it is a brilliant idea, absolutely great idea to try and see if you can cross-foster them. A lot of mama cats and a lot of mama dogs will readily accept new babies. There are some people that say that you should try to make them smell like the baby she already has, but there's no actual science to back that up. So you can do it. It's not going to hurt those babies to make them smell like her litter of babies and then add them. But there's no science to support that she's more likely to accept those kittens or puppies. In cats, you want to make sure that you're screening both the mom and the baby for FELV. We don't recommend FELV, FIV screening as screening tests, but in this instance, you do want to know because you don't want to be exposing the little babies to an FELV positive mom. It's unlikely to be transmitted from the tiny little baby to the mom and to the rest of the litter, but if you do have an FELV positive mom, you don't necessarily want to be cross-nursing little orphaned kittens onto her. You want to make sure you're chaperoning your introductions. So don't just put the 3 or 4 kittens in there or the 2 new puppies in and walk away. You want to make sure that the mom is accepting of them. And you'll know fairly quickly. They growl. I don't know how many of you guys have cross-fostered babies onto new moms? Good. So you guys know. How many of you have seen it go poorly? How many of you have seen it go really well? Good, yeah. So, and you usually find out pretty quickly. Is that the experience you guys have been having? Yeah? So I've found that if they are going to reject them, usually at least with cats, you start hearing them growl within a couple of minutes of putting them in there. They're like, that's not my baby. I'm already caring for a couple of babies, and I don't want that one too. But then there are others that are like, oh, yeah, that's totally fine. Like, come here, nurse, we're good, it's perfect. And you actually know pretty quickly. And when you do cross-foster, to make sure and kind of continue to monitor the progress and make sure that it's actually a good relationship, you want to weigh those kittens. We're already recommending that you weigh the kittens that came with that mom, but you want to make sure that you're weighing them to determine that 1, she's making enough milk for those kittens that you've added, and 2, she's allowing them to nurse. She's not preventing them from actually latching onto her. So in terms of nutrition, we already talked about it. Nursing moms need puppy and kitten food. They have really high caloric needs. They're producing lots of milk for those babies daily, and so that takes a lot of calories. And starting at weaning, kittens and puppies need kitten and puppy food as well. Starting around 3 to 4 weeks of age, even if they have their mom, you want to start offering a gruel mixture of the same food you're feeding mama. So you can either take canned food and mix it in with water if you've got mom, or if you felt like being like a dairy farmer, you could use her milk, or you could use formula. Or if mom really likes the dry food and you don't actually have the canned food available, you can take a blender and mix up the dry kibble and mix it in with some water or mom's milk or some formula as well. For those puppies and kittens that are really, really stubborn and they're like, I don't actually want to eat this food, like I'm perfectly happy with mom, and mom is like, no, really, like please just go. You can try meat-flavored baby food, but make sure you get the stuff that doesn't have onion in it, because onions are toxic to puppies and kittens. And again, as you're doing that transition, you want to make sure that those babies are getting the calories that they need, and so you should still, all along the way, this is a recurrent theme, you should be weighing your puppies and kittens as a marker of their hydration and of their growth. If they're not gaining weight, then there's a problem. So, we talked all about mom, but you get a stray litter of kittens that walk into the shelter. What do? First, you recognize, and I know you all know this already, but they're really fragile, and they don't have an immune system of their own. And if they're a stray, you don't know how much of their immune system they've gotten from their mom. We estimate that about 25% of their protection comes from transplacental transmission of antibodies. So while they're still in the womb, mom is giving any protection she has, about 25% of it is actually getting to her puppies or kittens. And then colostrum should be consumed in the first 12 hours. So if they're good nursers, if mom's a good mom, if mom didn't run away as soon as she had puppies or kittens, it's possible, and she had a good immune system, it's possible that they're really well covered. But we don't know that, right? So this stray litter of kittens walks in with no mom, and we can't say, hey, how protected was your mom? Do we know? We have no idea. So we want to make sure that we're treating them like they're really susceptible to absolutely every disease. They start to build their own immune system around 4 weeks. That's when mom's antibodies are really starting to wane, and their immune system is like, oh, I need to protect myself. And so that's why we start to vaccinate them at 4 weeks. They may not respond to a vaccine yet because mom's protection is still there and acting big and tough, but we start to vaccinate then in case that's actually when they're susceptible and ready to respond to a vaccine. And their immune system isn't completely developed. I wouldn't say it's really completely developed until farther along from here, but we stop their vaccine series between 4 and 6 months of age because we suspect that maternal protection has gone down enough that they could have mounted a response to a vaccination. You want to make sure when you're handling them, because of how fragile they are, how susceptible to disease they can be, that you're washing your hands, you're washing the bottles that they use, and any equipment that's associated with those puppies and kittens before and after you use it. You want to make sure that you're providing proper environmental support and you're minimizing their stress. And to minimize their stress, you want to make sure that they get to eat and sleep and grow in an undisturbed manner. If you have kittens that aren't sleeping, if you have puppies, you're like, wow, these are the most active puppies I've ever seen. They're not the healthiest ones because they should be fat and sleepy and happy. If you don't have sleeping kittens and they're not eating well, you have a stressed puppy or kitten and they could have a health condition. Your priorities for their care are thermoregulation. We're going to talk specifics about how warm their environment should be in I think the next slide. You want to make sure that you're providing them adequate nutrition. You want to make sure that you are helping them eliminate if they're of the age where they need that assistance. Again, infectious disease prevention, if they are old enough, if they're 2 weeks or older, the medical team should be deworming them. If they're 4 weeks or older, they should be getting their vaccinations. And all the time, you want to make sure that you're keeping them clean and dry and happy. Again, like I said, they need to be gaining weight, and we need to be minimizing their stress. And mom is always best. So if possible, we need to make sure that we have a mama cat for them, and if not, then we can act like that as well. So for these kittens and puppies that can't regulate their own body temperature, you want to give them a warm nesting box. So for the first week, the environment surrounding those puppies and kittens should be somewhere between 85 and 90 degrees. I don't know about you guys, but that's not comfortable for me. But to keep those kittens and puppies happy, that's what they need, because their body temperature is actually sitting normally around 95 degrees, and that's not warm enough. So they need to be supported and warmed. From day 8 to 28, we start around 80 to 85 degrees, and that kind of tapers down the older they get. So I say 80 to 85, but by the time you're getting to about 4 weeks, we're looking at about 80 degrees in the environment. Then once they get over 4 weeks, you notice that it kind of goes back down to what we expect to be room temperature. So in order to heat them, what we recommend is a nesting box, and I wish I had gotten a picture. I meant to stop over at Tompkins and show an image, but I don't have one. What are you guys using for nesting boxes for your litters of kittens or puppies? Empty Amazon boxes, that's good. The bottom part of a dog crate, that's good too. Yep, so at Tompkins, we actually use big plastic Rubbermaid tubs. You poke holes in them. You put a nice towel in the bottom, or nice blanket, nice fluffy bedding, so that it maintains heat. And then you can actually put the heat source either underneath it if you're using electric blankets, or you can use things like the Snuggle Safe bricks. Important to know that if you're using something like a Snuggle Safe, or you're putting some kind of heating source in there, you need to make sure that it's only part of the box, because they need to be able to move away. Some of them, when they're not old enough, you need to be checking. But also, you need to make sure that that environment is dry, because if it is wet, you can actually transmit the heat from the heating blanket, whether it's a blanket or your heating pad or your Snuggle Safe. It can actually transmit the heat directly to the puppy or kitten and cause burns. So one of the more kind of tips and tricks that we use is you can actually put a heating pad underneath the actual box or below a waterproof barrier, so that the actual moisture doesn't wick down to the heating source, so that the kittens aren't actually at risk of being burned. You also want to make sure that their nesting box is roomy enough, but not too big that it could be drafty or not maintain the heat that they need. And if you have mom and you have a nesting box, then you want to make sure that mom has the ability to get out of the place where the kittens are corralled and go kind of live her life and go back to them when she knows that they need care. So health monitoring, again, I can't harp on this enough. You want to be weighing your kittens and puppies daily to make sure that they're gaining weight. You want to make sure that you are monitoring their nutritional intake, make sure that they're nursing. If you've got a mom and kittens, that they're latching appropriately. You should hopefully see them latching at least once a day. I know you all have jobs, and the benefit of having a mom with babies is that the mom takes care of everything, but you do need to be at least a little bit kind of observant to make sure that she's actually caring for them the way they need to. For these kittens that you are bottle feeding and that you're helping transition and wean, ideally you should be doing fecal scores. How many of you guys have heard of the Purina fecal scoring system? Good. So puppies and kittens, they're not going to be perfect. They're not going to be your 3 to 4, but I don't want it to look any worse than kind of a soft serve ice cream type deal. I've ruined everyone's lunch. I forgot to apologize that I'm the only thing standing between you guys and lunch right now. But I'm going to do my best to make sure that you're not actually hungry by the end of this. You're also monitoring for other clinical signs. So you're looking for URI, especially in kittens. They can be exposed to herpes virus by their mom when they're really little. And so you can go on to have those kittens whose eyes look bulgier than they should before they're open, and they actually have purulent pus discharge from their eyes as soon as they're opening. Or they just have nasal discharge when they hit kind of 3-4 weeks of age. You're also monitoring to make sure that they're not anorexic. A non-eating kitten, a puppy who's not eating, is a serious problem. And you may notice that they didn't eat very well in the morning, but if they're still not eating well by the evening, you need to be talking to someone on your medical team about getting the problem identified. Also, lethargy. So if your kittens are overly sleepy, you want to make sure, I forgot I had that picture of our Purina fecal scoring chart. You don't really want them to look any worse than you don't want them to go above a 5. And this, it'll be in the slides that they provide you, but this is a kitten weight chart and kind of what we would expect for baby kittens. And keeping in mind how much volume they need to be fed. Basically, the stomach capacity of a kitten and a puppy is 4 milliliters per 100 grams. And so every feeding shouldn't be more than that calculated volume. But if you know the amount of food that they need to be fed per day, that tells you how much they need to get at each feeding and how many times you need to feed them per day. Does that make sense? So this is where we get into territory where I'm telling you guys how to do things, and I can tell you I am not an expert at bottle feeding. I'm actually not very good at all. But I can tell you how to do it, and you will hopefully be better than I am at bottle feeding kittens. So you want to make sure that the puppy or kitten is nice and warm. They should feel warm. They shouldn't feel cold. If they feel cold, you should be either bringing them to medical or checking a temperature on them, because I'll talk to you a little bit about it in future slides, but you should never feed a cold puppy or kitten because they can't actually digest the food. You want to make sure that the formula is nice and warm, between 100 and 101 degrees, feels warm on your inside of your wrist. These puppies and kittens should be standing or should be held upright. They shouldn't be cradled like a human baby. It's adorable when people do that, but it's actually not good. They could aspirate and can make them very sick. You want to have their nipple at a slight angle or straight. This helps avoid the amount of air that the kitten is ingesting. People talk about having to burp kittens and puppies. You shouldn't have to do it as much if you hold it at an appropriate angle that's mimicking the way mom would feed them when she lays on her side. You want to tease them with the nipple to promote their interest and hopefully encourage them to latch. You want to bottle feed them slowly. This is, again, where I'm not particularly an expert, but the nipple size and the hole needs to be appropriate so that you're not flooding the kitten when you feed them and they're not working so hard that they get exhausted and they don't get enough volume. Ideally, you'll test the delivery, and it should be a very slow drip that comes out. It shouldn't flow a ton, and you shouldn't have to squeeze the bottle to get it to come out. It takes patience, which is probably why I'm not the best kitten bottle feeder. I'm not the most patient person in the world. I know a lot of veterinarians aren't, and so I think that may be why we tend to not necessarily be the best bottle feeders. You want to make sure that they're latching and not chewing, and I have a nice video of a kitten who has a good latch. It's actually one of my favorite things to see. I don't bottle feed kittens very often, but there we go. You see his little ears? That means he latched, and it's the cutest thing in the world, right? You see the little ears just kind of twitching. You know that they're actually nursing properly. You want to make sure that you're using the appropriate milk replacer. So kitten milk replacer, there are a million different brands that you can use for kittens. You want to make sure that you're using an appropriate puppy milk replacer. These are just examples of some of the brands available. Some people may say that you can use goat's milk, or there are emergency homemade formulas that you can make. I would advise you that you should not be using them except in the case of an emergency. Dog and cat milk has a very specific formulation in terms of protein content, fat content, and other nutrients that is not equivalent to goat's milk and is not equivalent to adding an egg yolk to some evaporated milk and sugar and other concoctions that you can see on the internet. So really, if you don't have mom, the best thing you can do is one of the commercial formulas. Puppies on goat's milk will grow, but they won't grow as well as they would on formula, just like they wouldn't grow as well on formula as they would by having their own mom's milk. And make sure that you follow the instructions for every product because they all have their own formulation. So don't just say, well, the other one said 3 scoops of formula to 2 scoops of water and assume that it's the same across products. Feeding amounts. This isn't scientific. You want enough, but not too much. I did give you that chart that had all of the values in terms of what their stomach capacity would be, what their daily needs are, and you can use that to figure out exactly what they do. Or you can allow, in some instances, kittens or puppies are smart enough to eat until they are no longer hungry, and they're not going to overfill themselves, but you can't always trust that. So keep an eye on how much they're eating. Use the feeding charts provided by the product that you're using. Again, weigh them daily. Are you seeing a theme? If you want to monitor the health of your puppies and kittens, you should be weighing them daily. It's one of the best ways you can track their progress. You want to make sure that you're mixing and storing them appropriately. So if you have leftover formula, it should be stored in a glass container in the refrigerator until the next time you want to use it, and it should be discarded within 24 hours of reconstitution. So if you made it at 8 a.m. on Thursday, on Friday morning at 8 a.m., if you have leftover, you should be tossing it. And then try to be mindful and don't waste, because we know that formula is expensive. We know that it's on everybody's wish list. And so you don't want to go through it and be wasting half of a container because you have to throw it out the next day. Feeding times. We talked about their stomach capacity already. But they should have small, frequent meals. In the first week or so, it's usually every 2 to 3 hours. Sometimes there are kittens that eat more frequently in that. Sometimes it's 1 to 2. And then slowly you're increasing the amount of time in between feedings. And I'm sure you guys have all bottle fed a bunch, but you really do learn to read your kitten's signs. There are some that you can put right next to your bed and they cry loud enough that you know when they're hungry and they wake up. And there are others that you actually need to help them along because they're a little lazier. Like I said, don't ever feed cold neonates. Don't feed cold puppies. Don't feed cold kittens. If their body temperature is below 95, you shouldn't be feeding them because they won't digest properly, they won't have a proper swallowing reflex, and they can actually are more prone to aspiration. So we really, really don't want to feed them when they're cold. You can use human body warmth. It's probably mildly inappropriate, but you see rather big busted women may kind of warm kittens there. You can put them kind of near your belly. They've seen little kitten sweatshirts under your arm. You can make, how many of you have heard of a bear hugger? It's something that's used in veterinary practice. Those are really expensive, but you can make your own. You can get a hair dryer and a pillowcase, and you can hold it together and aim the blow dryer up, not towards the kitten because you don't want to be blowing onto the kitten, but you can aim it up and it fills up like a little hot air balloon. And it's this nice warm cocoon that acts just like a bear hugger would if you bought one in veterinary practice. You also want to check the environment and make sure that you have it between 85 and 90 degrees if they're little, in their little area. If they're really cold and you want to support their blood sugar, but you can't be feeding them at this point, you can offer Karo or maple syrup kind of smeared on their gums and hope to give them just a tiny little boost while you're trying to get them warm. And at this point, you should be calling for help. You should be contacting medical. And it's important to know that we want you to warm them up, but you can't warm them up really, really quickly. It should be over the course of 1 to 3 hours. So that's why we offer K-Waro maple syrup, and we try and warm them up gradually and get them to come to the temperature where it's safe to feed them. Now, we already talked about elimination assistance, but you're doing it before and after meals. Some kittens, in my experience, potty beforehand. Some of them potty after, and some of them do both. You want to make sure you're using soft materials. I've seen people use cotton balls. I have personally used the really nice, expensive gauze. We probably shouldn't be doing that, but I find it's nice and soft, and it works really well. You want to monitor and make sure that when you're stimulating them, you don't have to stimulate them so long that they wind up getting sores. You want to monitor their stool consistency. Kittens and puppies on milk replacer or nursing from mom won't have perfectly solid stool. So if you're seeing perfectly solid little nuggets, they may actually be dehydrated. But you also don't want liquid just running out of them either. You want to keep records. I will show, I think a couple of slides from now, I have an example of a daily kind of diary that you can use. And you want to make sure that they're staying clean. We already talked about that, so I'm going to skip it. But weaning means it's time for a litter box for kittens, and you're not going to give them the huge one that requires them to climb like they're climbing Mount Everest into the litter box. You're going to give them a nice low-sided thing that they could probably just step into, maybe 2 inches high, non-clumping litter, because at this time where they're weaning and they're starting to use a litter box, they're starting to test everything with their mouths. You don't want them to eat clumping litter because it can cause an obstruction or even just constipation. So we don't want them eating litter, and so if you feed them non-clumping, it's at least just kind of gritty stool instead of problematic stuff. A lot of them will self-teach. My favorite story, I was helping my mom with bottle feeding, and we had this adorable little kitten. We named him Douglas, and he self-taught himself by, my mom had a paper bag on her counter, and we were playing with him on the counter, and all of a sudden he just ran into the paper bag, and we saw this little trail of pee come out, and we were like, oh, that's awesome, like, yay, Douglas, good job. But we also didn't want pee on our counter. But we learned that he was at that point where he was ready to start using a litter box himself. And sometimes it takes coaching for the slower kids, just like weaning. One of my favorite weaning stories is I had a foster come when I was an intern way back in the day in 2012, and they're like, this kitten just isn't gaining weight. Her sibling is getting really fat. I see her at the bowl. I see her eating. I don't understand what's happening. So I brought her into the room. I did an exam. There was really nothing wrong with her. But I put some food in front of her, and she was nursing the plate. So she wasn't eating like her brother was. She wasn't taking mouthfuls and chewing it up a little, the kind of slurry. She wasn't drinking it. She was suckling on the plate. So we named her Darwin, and we supported her a little longer until she really started to get the hang of eating it herself. Bath time, we want to make sure that we're keeping these kittens clean. If we're leaving food material on their faces and you're kind of only cleaning them once a day and not after every meal, you can wind up having little kittens with bald faces that look like they have ringworm. You can give your vets a heart attack. I used to have a ton of people bring their foster kittens in and be like, oh my God, why are they losing fur? And I was like, how often are you cleaning their face? They're like, oh, you know, when it gets crusty and they have food face, I do it. And they just kind of wiped all of the fur off their face. I've got to speed up just a little. We want to make sure that we are protecting them from infectious disease. I've harped on this the entire time. We can start flea treatments in micro doses if you have a veterinarian on site as young as 2 weeks, which is really nice. Mom is always best. Please, 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 please don't mix litters, especially kittens, really puppies as well. But we don't want you mixing them because mixing causes sharing of infectious agents. And just like I said, if we don't know the history, we don't know their kind of protection against the different infectious diseases. And so you can have one kitten that can kind of carry it and just show mild signs, and you can cause horrible illness in a different kitten from a different litter. You want to monitor for sibling trauma. How many of you guys have had litter mates that have suckled on each other? It's a veterinarian's nightmare. How many of you guys have a good solution for it? Separate them. The other thing you can do, some kittens will suckle on themselves, which is problematic. You can make them sock sweaters, especially the little boys, and if it extends down beyond there, they can't actually do it anymore, and they're protected. You want to make sure in that important socialization period that you're not flooding them. You're introducing them to new things slowly so that they're not too scared. And you can start to play with them when they're ready to play. And you'll start to notice that they kind of run around like little maniacs, and that means they're really ready to start playing with you as well. So having puppies and kittens come into your shelter, you need to have an intentional plan for them from start to finish, from intake to outcome. Because according to the ASV guidelines, we have effective population management is a plan for intentionally managing each animal's shelter stay that takes into consideration your ability to provide care. So do you have the capacity to care for 20 kittens at one time in your shelter? Probably not. I'm assuming a lot of you guys are smaller shelters. You need to find foster care. So, like I said, we want their stays to be as short as possible. We want to avoid bottlenecks as much as possible. I'm going to talk about foster care just a little bit and some of your tips and tricks for it. And we're going to talk about kitten nurseries because I imagine a lot of you have seen the bigger organizations are starting to do that and wondering if it's something you can do. I encourage you to have something called a Foster on Deck program. How many of you guys have heard of that? Okay, so Foster on Deck is when you actually have your fosters fill out a Google Sheet or an online form when they are ready and able to take a puppy or kitten, like at a phone call's notice. You can rank yourself and say, like, I want a kitten now. So if a kitten came in 12 hours, I would be ready as long as you gave me all the supplies I needed. Like, send them up. Like, here, it's your batting order. Who are you calling for which kittens when? So that if you get a call that someone found neonatal kittens and they want a foster, like they want to bring them in and drop them off so you guys can care for them, you already have that foster lined up and you can say, hey, Sue, I've got 6 bottle baby kittens. Just kidding, only 3. And I need a foster now. Can you actually, they're scheduled to come at around 4 o'clock. Can I get you to come around 4:30 so that we have time to do their intake evaluation and you can take them right home today? And so that way your kittens are spending 15 minutes in the shelter instead of the kitten gets there and you're like, oh God, I got to send out my foster email. I've got to call Patty because I think she said that she was going to be here for the next week, but I don't know. Let me call and see if we can do it. And then you wait hours, and you're providing that bottle baby care in your shelter, taking up the time of either your medical staff or your animal care staff, waiting and exposing those kittens and puppies to the shelter environment. How many of you guys are doing spay neuter at 8 weeks, 2 pounds? Good. I don't have to get on a soapbox. It is safe. It is fine. They will live wonderful, happy lives. Do it at 2 pounds for kittens. Do it at 8 weeks for puppies. And you want to make sure you have adoption promotion. If you have people that are unfamiliar with foster care, bottle feeding orphan kittens, I highly encourage you to go to the Maddie's Fund kind of orphan kitten care website. They have videos on how to bottle feed. They have videos on how to potty kittens. They have all different videos on the basic care that's needed for bottle feeding neonatal kittens, and it's wonderful. So, how many of you have bottle fed puppies? Not as many as kittens. It's fairly similar. You need a larger nipple if it's a larger breed puppy, but pretty much the same. Foster needs, you want to make sure that you're keeping them in a space that you can easily disinfect, especially if you're going to go through multiple puppies and kittens. You want to have them isolated from your other animals because they may have infectious diseases that your pets don't have. Your pets may have something that they're susceptible to. You want it to be warm and dry, fresh air, no recent disease. I say no human contact, no human traffic, but minimal is better. So you want your caretakers to go in, obviously, but you don't want to have just a ton of people going through every day. You want to have it in a practical space that's not drafty. And you want it to be indestructible for when they hit that kitten ninja stage or that really destructive puppy phase, so they can't really get themselves into trouble. This is what I was talking about for a daily monitoring sheet. It talks about their kind of character status, what they're doing, whether they're vomiting, diarrhea, what their fecal score is, if they're eating, if they're on any sort of medications. It's awesome to have a monitoring sheet like this. Sorry, now I'm rushing because I want to make sure you guys get all this information. When you're fostering animals, when you're encouraging people to foster, you want to make sure that you're thinking safety first. You want to protect them from other pets. You want to protect them from humans. I would never foster a kitten and leave it anywhere that my 3-year-old could just pick up the bottle baby and run around with it. You want to keep them as safe as possible. You don't want to have your kittens in an area where you sew and you have thread all over the place because that's a nightmare for myself and my other veterinary colleagues. We don't want linear foreign bodies. We don't want electrical cords easily accessible for all those kittens and puppies that are starting to test out the water and see what things are food and what aren't. You don't want places where they can get trapped. You don't want recliners or rocking chairs. I can't tell you, when I worked at the shelter in South Jersey, how many sad instances I had where there was a kitten that had gotten behind a recliner and they came to me and there was nothing I could do. You can get head trauma, you can get spinal trauma, you can really just squish a kitten in a million different ways, keep them away from recliners and rocking chairs. And no toxins. As a vet, I want you to disinfect all the things. I recommend spot cleaning when you have the kittens, but if you're going to foster kittens and puppies kind of serially, as you've finished one litter, you're going to take another. You should be encouraging fosters, or you as fosters should be cleaning all of the organic matter with a detergent, so a nice soap, and then you can either disinfect it with dilute bleach, or if your shelter uses Excel or Rescue, you could take a little bit of that and kind of mop down your bathroom, clean surfaces with that. And washing your hands and arms before and after handling kittens goes a long way. Same thing with puppies. If you're not going anywhere else and you have dedicated clothing for your home, you can forego this, but I would recommend kind of considering scrubs or a lab coat, something that you can interact with the kittens where they're not going to be exposed to anything except what they've already done. You want to disinfect all the things in between. You want to discard anything that can't be disinfected. And you want to protect their food source so that it doesn't spoil and it's not contaminated by the previous litter. This is why it's important, because of the cumulative exposure risk. If you haven't disinfected the space that they're staying in between, it's like you were housing them together. And I don't want you to be housing 10 litters in your house at the same time. And I don't want you to foster 10 litters and not disinfect in between, because the risk is the same. And the risk increases with every subsequent litter that you have in the same space. I wanted to cover nurseries. So neonatal nursery programs are propping up all across the country now, and they're really a blessing for a lot of communities. It's in-shelter care of the kittens and the puppies, and not just keeping kittens in your shelter. They have a specific plan in place for how they intentionally manage those animals in their care. Ideally, it'll be in isolation, so it's a separate building or it's separate care staff, and it's a way in which the management is basically managing that population, managing staff and volunteers so that those puppies and kittens aren't exposed to everything else in the shelter. And it's not a substitute for foster. I can't tell you that you can just make a nursery and your need for foster will go away, because it won't. So some examples that I have across the country: North Shore Animal League, with an intake of about 10 to 15,000 animals a year, with a large transport program and a full-service veterinary hospital with 7 to 12 vets on staff, has a nursery on campus, but it's in a separate facility. So they have an entirely separate building and they're actually redesigning their facility so there's going to be glass so you can actually observe and watch people bottle feeding their puppies and their kittens. And they will do it from neonatal age through adoption age. And it's mostly done by their staff. My next example is Jacksonville Humane in Florida. They have an intake of about 5,000 with a really high live release rate. They found that as their live release rate increased, in their community, kittens were still the largest group for euthanasia. And so they really wanted to take care of that. They wanted to decrease the rates of euthanasias in their shelters. And so they created Kitten University, which was like a nursery, but they didn't actually keep their nursing babies on staff or on site. They actually sent them to foster, so moms and kittens. But once they hit 4 weeks, because they could get people to commit to getting them to the weaning point, they just couldn't keep all of those other kittens in foster care beyond that. They made Little Kitten University, where the 4 to 8 week old kittens would come and they would get their socialization, they would provide adequate care, and then once they hit 2 pounds, they would go to adoption. And they had 2 full-time staff, and the rest were volunteers that helped support. And I think it was around 15 or so volunteers that were helping. Another big one, and I encourage you to go to their website. They have awesome videos that go through, that go over, and you see like what 24 hours looks like at San Diego Humane. They opened their nursery in 2008. They were one of the first. And they have an intake of 5,000 animals. They have a budget of roughly $10 million. In the nursery, not for the nursery, in their entire organization, it's $10 million. They have 24 staff members that operate around the clock in a 24-hour nursery, and 20 volunteers that come through and take care of these kittens from neonatal stage through 8 weeks. But they also have foster care because they have a capacity of about 250 kittens at a time and only 1,200 a year. And so it's actually still higher than that. And then housing, they separate it by 0 to 2, 2 to 4, and 4 to 8 weeks. And that is my last example. No? All right, thanks, guys. And thanks to Maddie's Fund for making all of it possible.